The next topic that I'd like to move on to is in KRAS mutant lung cancer with an agent called Selumetinib in combination with docetaxel, presented by Dr. Yanni. So this is a phase 2 double-blind randomized placebo-controlled multi-center trial involving an agent called Selumetinib, or AZD6244, which is a selective tyrosine kinase inhibitor which inhibits MEK, one of the downstream mediators of the MAP kinase pathway, which is important in proliferation. So this clinical trial was asking whether Selumetinib adds anything to docetaxel, which is a standard second-line chemotherapy in non-small cell lung cancer. So one arm had Selumetinib plus docetaxel, and the other arm had placebo and docetaxel. These, again, were patients with KRAS mutant tumors who had failed previous therapy, one line of therapy specifically, with the primary endpoint being overall survival. This is very impressive. Out of a little over 70 patients total, a good size for a KRAS-selected clinical trial, the response rate was 37.2% for the Selumetinib and docetaxel arm, compared to a surprisingly low 0% on docetaxel. The progression-free survival at 6 months was also similarly different between the two arms. There were no complete responses, unlike the erlotinib and docetaxel trial that Dr. Szynski presented. No complete responses with docetaxel alone, but a decent number of partial responses. Let's look at the progression-free survival. The progression-free survival was 5.3 months on the combination arm versus 2.1 months on the docetaxel arm alone. This 2.1 months is very equivalent to other single-arm trials of docetaxel in the second and further line setting. 5.3 months is indeed significantly better than that. The overall survival missed statistical significance with a p-value of 0.2, needing 0.5 in order to hit statistical significance. But it does look like there's a separation of this curve, and I wonder if a larger trial might show a difference in overall survival. So I don't think that it's a fault of the trial that it did not show a statistically significant difference in overall survival. Safety and tolerability, though, were a concern. I'd point out that on the combination arm, 60% of patients had any SAE versus on the docetaxel alone arm, 31% of patients did. Many patients were hospitalized, 47% versus 19%, and many patients had to be dose reduced on the combination arm versus the placebo arm. Many patients had febrile neutropenia, so some of the common side effects were diarrhea, nausea, vomiting, edema, rash, similar to most side effects of tyrosine kinase inhibitors, plus the additional effect of chemotherapy. But of note, 18% of patients on the combination arm had febrile neutropenia, which is a concern, and no patients had this on the placebo arm, although many patients were actually neutropenic. So overall, I think that these response rates, progression-free survival numbers, are good, but not quite as good as what we've seen for progression-free survival and response rates from targeted agents in selected cancers like erlotinib for EGFR mutant cancer, where we see a response rate of 70% and progression-free survivals of 9 months or better. Overall survival is usually no different in those trials because patients can cross over, but I think this is promising, and this is the first targeted agent that we've seen potentially active in KRAS mutant non-small cell lung cancer. Of note, the Selumetinib alone doesn't seem to have much activity in KRAS mutant lung cancer, so there does seem to be something to the combination biologically. However, toxicity is significant and much worse than docetaxel alone. Not that docetaxel is an easy drug by itself and includes the side effects that we went over. I think the ideal KRAS-targeted therapy would be somewhat less toxic and somewhat more effective overall.
Thanks for listening. If you like and learn from our GraceCasts, you can subscribe on iTunes by just searching for the term Cancer Grace, find podcasts in the subject you want, pick a format of audio or video, and then just click subscribe. It's that easy. And for those of you who don't want to miss any of our programs, there's even a feed for all subjects. You can also find us on YouTube at Grace for Cancer Info, and that's the number 4 in one word, Grace for Cancer Info. Finally, if you haven't been there yet, please check out our Grace website at www.cancergrace.org. And don't forget that donate button in the upper right. Our content, which helps tens of thousands of cancer patients around the world every month, is made possible by your support. Thanks again.